Hi, today I'm going to be talking about a common illness present in the dog community, known as kennel cough. So what is it? Kennel cough is the nickname for a highly contagious common airway infection in dogs. The medical term for it is actually canine infectious tracheobronchitis. It usually occurs in places where there are many dogs in close quarters, like a kennel. It can be spread through direct contact with other infected dogs, through airborne droplets that are released when an infected dog coughs or sneezes, or through contact with contaminated surfaces such as shared water bowls or toys. There are several viruses and bacteria that can cause the illness. However, because the symptoms are very similar, all infections are referred to as kennel cough. The main viruses and bacteria that can cause the development of kennel cough are Bordetella bronchoseptica, which is the most common bacteria, canine parainfluenza, which is the most common virus, canine adenovirus 2, and canine distemper. If you take a look to the image to the right, you can see that they have different infection zones. For example, CPIV, which is canine parainfluenza, affects more in the nasal area, while bronchoseptica affects lower in the trachea. If your dog is exposed to kennel cough, it may take a few days for symptoms to develop. The most distinctive symptom of kennel cough is a loud, hacking cough or retch, often paired with a honking noise. In addition to this, you may notice sneezing, lethargy, loss of appetite, low fever, and a runny nose. Many mild cases of kennel cough can actually be treated with just a week or so of rest. But there are a few things you can do to help your pet. One of these includes utilizing cough suppressants. Cough suppressants may ease the symptoms of your dog and help them sleep at night. In addition to this, your vet may prescribe antibiotics which can kill the Bordetella bacteria, and they can be used to prevent secondary infections from causing complications. These recommendations were pulled from the references listed at the end of this presentation. Please consult with your veterinarian before further action. So how can we prevent this? Well, one way is through vaccination. There are vaccinations for each of the pathogens I previously mentioned. One of the most common vaccines against kennel cough is the Bordetella vaccine. Dogs who are boarded a lot, go to dog daycare, compete in sports, or just exposed to groups of dogs may benefit from the vaccine. Oftentimes, places like these require it. In addition to preventing your dog from contracting kennel cough, you can make sure other dogs don't get it as well. You can do this by isolating your dog if you notice any symptoms, and if your dog does end up contracting kennel cough at some point, make sure he or she is kept away from other dogs for at least 2 weeks after symptoms disappear.